Professor, respected Professor Dr. N. Venkatasan Rao is principal of Arul Mingu Kalasangam College of Pharmacy. So it's my pleasure to join with you and share my knowledge and experience among you. I'm Sushma
Dr.
Maharjan.
Excuse me, madam. Dr. Sushma, madam.
Yes.
Thanks, madam. Thanks. Well, most welcome you, madam. Thanks and gratitude for your wonderful support towards the development of our students' career. This is Dr. Venkatesh, madam.
Sorry. Yeah. Thank you, Professor.
On time. I could not join on time, madam. Now only connect, madam.
Okay, no problem.
Proceed your presentation, please. Continue.
Sure. Okay, myself, Sushma Maharjan from South Korea. Currently, I'm doing my PhD degree on pharmacology in Dongguk University under the Professor Kyung-Soo Nam. Basically, I'm doing my research on the cancer cell, especially the breast cancer. So, firstly, I would like to thank you so much for providing me opportunity to present my knowledge in front of you. First of all, I would like to thank my friend Mr. Rajiv Bajajare, who also doing PhD in same university, Dongguk University, and as well as the respected Professor Dr. N. Venkatasan, principal of Arul Migu Kalasangam College of Pharmacy, who give me opportunity like present you among all the like students and share my experience in front of you. And so it's is a very crucial situation. It's like COVID-19. It's everywhere and it's affecting in our like regular class, operating the regular class. So despite these challenges, respected Professor N. Venkatasan managed to it's such a webinar for the students to enhance the knowledge of the student. So I really appreciate and I'm very pleased to be a part of this. So let's begin my presentation. Like my topic is cancer cell biology and therapeutic approach. So today I'm going to cover on the following heading, like introduction, basic understanding of cell biology, about the cancer, risk factors, types of cancer, diagnosis, and different stages of cancer, treatment modalities. So it's cancer is considered as a big thing in our society. So nobody want to talk about this topic, because if somebody has like cancer in our locality, people look at him in a like very like sorrow way, like they think like it's a last journey of their life phase, and it's though there is a many challenges of treating, and as well as there is a different chemotherapeutic agents and agent to treat the cancer, a cure, as well as if it's diagnosed in early stage. So let's talk about what is the cancer. So cancer is an abnormal, uncontrolled proliferation of the cell. Is basically the related to the gene. It's occur when gene is mutated or any disturbance in gene, and it's lead to unregulated proliferation of the cell, and is also considered as a second leading cause of death globally. About the statistic, cancer statistic, we just look at a glance of global burden of cancer. According to the WHO, we can see in 2018, 11.1 million new cases were like reported. So 9.5 million cancer-related deaths were observed globally. So by 2040, means 2040, the number of new cases per year is expected to be rise to 29.5 million, and the number of cancer-related death would be like 16.4 millions. If we see the scenario, that is a very dreadful and is very challenging. So day by day, the cancer-related cases are also increasing, and though there is a healthy life expectancy, education level is higher and standard level is higher, but cancer is still in the increasing in those countries, except the cervical cancer. In that cancer, that it is more prevalent in those countries with the low income population. In that case, is more prevalent. Here we can see the data from the WHO recently published. We can see the global scenario in both gender. This is a top 10 that cancer list. It comes the lungs is comes the first position. Like it's 12.3% of cancers are comes under the lungs cancer. So we can see lungs, breast, colorectal, prostate, stomach cancer. These cancer are like most commonly occurred in both population, male as well as the female populations, is as per the WHO is recorded in 2018. Yet, if we see the incidence of men, lungs, prostate, and colorectal cancer, these three cancer is top three cancer for the men. You can see the lungs cancer is more commonly prevalent or most commonly observed in the male population. Likewise, in case of female population, we can see breast cancer. Breast cancer is most commonly occurring cancer among the all cancer, and second is colorectal and lungs cancer, cervical cancer, and thyroid cancer. So from this also we can say it's most commonly occurring is lungs cancer, breast cancer is most commonly in both in the male and female population. Now, what is the cancer cell and healthy cell? What is the difference between the cancer cell? Uh, we know the cancer, this cell is a small functional unit of living things. So it contains different organelles, cytoplasm, nucleus, and other like DNA materials, lysosome, mitochondria. It has its own functions, like own special functions, depending on the location of the body. Either these grow, replicate, repair the body organs. So it comprises the genetic materials like either RNA or DNA, and immune systems are regulated by this process. Here we can see the different type of the cell, like blood cell, muscle cells, nerve cell, bone cell, cartilage, liver cell. Though these has different type of the cell, but it has own functions. For example, in case of blood cell like WBC, RBC, platelets, this individual blood cell has its own functions. Like RBC carry the nutrients, oxygen from one place to the different organ. Similarly, the bone cell, cartilage, it has its own function, like own way to work in the different organ. Now, how the cancer working? What is the cancer cell? That the in healthy cells, there is a certain program set in the healthy cell. Means they know what to do and when to do. But in case of cancerous cell, what happened? They do not have any programming and further grow and replicate in in randomly. So they don't have any controlling. They uncontrollably they proliferate, and they serve as a no physiological functions and considered as a neoplasm. Here we can see the lump. Here is in tongue and ovary, and the right side we can see the some masses in the right side of the brain. This neoplastic neoplasmic new masses, new cells often form a clumping of the cell. Means like formation of some mass is known as the tumor. What are the risk factor of the cancer? So there are some like environmental factors like pollutions and other like we can see in people occupations, like people work in the mine. They have vulnerability of causing the cancer, and viruses like human papillomavirus, hepatitis C. Human papillomavirus is those viruses that are risk factors for the cervical cancer, and hepatitis C. This is a risk factors for the liver cancer, means hepatic cancer, and lifestyle factors like sedentary life, there's habit, and all other things that also lead to cause the risk for the cancer, and drug, medical things and hormones that also increase the risk factor for the cancer, and hereditary like BRCA1 and other PCA in prostate cancer. These are some risk factors that are the markers that rule out the cancer, and this that means increase the risk factors with those gene in our body. Now moving to the different type of cancer is basically on the type of on the basis of the tissue, that is sarcomas, carcinomas, lymphomas, leukemias. Now, what is carcinomas means? Carcinomas means those tumor that arising in epithelium and is most common form of the cancer, and usually transmitted or spread through the lymphatic system. And in case of sarcomas, what happened, that those malignant tumor that arising in the connective or muscles tissue, usually spread by the bloodstream, is frequently metastasis to the lungs. This above two carcinomas and sarcomas is considered as a solid tumor, whereas the lymphomas and leukemias is related to the our body fluid, like lymph and the lymphatic system and blood circulatory system. So on the basis of the onset of action, like it's further divided into acute and the chronic. Here we can see the acute myeloid leukemia, acute lymphoblastic leukemia. So in case of chronic, there is a myelodysplastic neoplasm, myeloproliferative neoplasm, myelodysplastic syndrome, chronic lymphatic leukemia. In case of acute in lymphoma is Hodgkin's lymphoma, diffuse large cells B cell lymphoma, Burkitt's lymphoma, and in case of chronic is a follicular lymphoma, multiple myeloma, chronic lymphoblastic leukemia. So in this way, it's categorized on the basis of the tissue. Now, on the basis of the origin of site, the cancer further divided into like following categories. Like, is in case of like throat cancer, esophagus cancer, lungs cancer, stomach cancer, bowel cancer, bladder cancer, prostate cancer, testicular, lungs. In case of female, that is throat cancer, esophagus, lungs cancer, breast cancer, stomach cancer, bowel cancer, bladder cancer, cervical cancer, and skin cancer. Here you can see in the red box in these two sides, the red box means that is more commonly occurring in the male populations and most commonly occurring in the female population. Here lungs cancer, bowel cancer, and prostate cancer more commonly occurring in among the male population, and breast cancer, bowel cancer, and cervical cancer more commonly occurring cancer in the female population. Now let's talk briefly about the different type of the cancer on the basis of the site of origin. Is lungs cancer. You know, the lungs cancer is more commonly occurring cancer in the men, and is a third most commonly occurring cancer in the women. And so according to the WHO, it said that there were 2 million new cases cases were recorded in 2018. So it's a topmost. It comes on the topmost cancer, and about the breast cancer is the most commonly occurring in the female population, and is the second most commonly occurring cancer among all the cancer. So about the data in 2018, there were over 2 million new cases were reported in 2018. So its risk increase with the age, and it can be prevented by self-examination and mammography. How can we do the perform the or self-examination by self? Here you can see this diagram. So by observing the shape and size of the breast in front of mirror, and by feeling the any is there any lump or thickening in the breast, we can feel, and if there is any lump thickening discharge from the breast, so we immediately contact to our doctors. So these are the steps to how to examine the physical examine the breast. Now talking about the colorectal cancer, these are the third most commonly occurring cancer in the man, and is the second most commonly occurring cancer in the female population. And about the data, is over 1.88 million new cases were reported in 2018. The warning sign of this colorectal cancer is like blood in stool, and is there any bleeding in the rectum while like stooling in rectal bleeding is a warning sign for this colorectal cancer. And about the prostate cancer, is the second most commonly occurring cancer in the male population, and is the fourth most commonly occurring cancer as a whole all cancer. So here we can see 1.3 million new cases were reported in 2018. Here we can see at the right side is a famous comedian Ben Stiller, also had cancer, prostate cancer, and now he is living cancer-free and declared the cancer-free on 17 September 2014. Now, about the ovarian cancer, is the eighth most commonly occurring cancer in the women, and is talking about the data is nearly 300,000 new cases were reported in 2018. The enlargement of the abdomen is common sign for the ovarian cancer, so it can be prevented by the annual pelvic examination. Here we can see a famous Bollywood actress as Manisha Koirala. She also diagnosed with the stage 4 ovarian cancer in 2012, and now she is living the cancer-free life after the treating its cancer at the Memorial Sloan Kettering in 2012 and 13. Now, talking about the cervical cancer, is the fourth most commonly occurring cancer in the women, and the eighth most commonly occurring cancer as a whole, all overall cancer. So, over 500,000 new cases were reported in 2018, according to WHO data. So, as we see, the human papilloma virus is related to the cervical cancer. So, if there is any cause of the human SBP virus, so it has maximum chance, like is more than 50% chance of causing the cervical cancer. Now, moving to the testicular cancer, though its cause is unknown, the commonly occurring in 17 to 24 years of those population. Another is the undescended testicles presence is comes under the great risk of the testicular cancer. And now the pancreatic cancer is also considered as a silent disease. Why it considered as a silent disease? Because basically the cause, sign and symptom of pancreatic cancer is not relevant to that, and it's difficult to rule out the pancreas until and unless it comes to the third and fourth stage. So it's difficult to rule out these cancers, and is called as a silent cancer. The survival rate of this pancreatic cancer is very less. It's only 4%. So the pancreatic cancer occur in those patients. Like these are the contributors, like inflammation, diabetes, and high fatty diet. These are the some contributor that lead to cause the pancreatic cancer. About the leukemia, it's related to the blood. We can see in leukemia there is a increase the formation of immature WBC. So we know the WBC play important role in immune system, but if this WBC is immature, it could not perform their own function. So it cannot protect against the immune. It cannot protect against the other like antigen and other disease. That's why it's called as a leukemia is a blood cancer. And the symptoms are like fatigue, paleness, weight loss. It can be a chronic or acute. Now talking about the causes of the cancer. Like there are various viruses, bacteria, some chemicals, radiation, dietary, hereditary, diet, and hormones. These are the some factors or some causes that can lead to the cancer. This all cancer that is basically based on the disturbance in the genetic sequence. So let's talk about briefly about the gene. We know in our body there are 23 pair of chromosome. The chromosome is made of gene. The gene consists of the DNA, which is made up of 4 different nucleotides like adenine, thymine, cytosine, guanine. Adenine pair with the double pair, adenine pair with the thymine, and the guanine pair with the cytosine. If there is any disturbance in this sequence, then it causes the it perform the irregular function. Here it happens in the cancer. Here you can see the cancer in the cancer case is chemical. These are the some factors that chemical, virus, radiation, hereditary that lead to disturbance in the sequence of the DNA, and finally it affect the proper functioning of regular cell. That I already told you that is cancer is the abnormal proliferation of cell due to the defective in the gene. Like there is an abnormal proliferation, like genes are main play for the abnormal functioning of that cell. Now, how the normal cell work and how normal cell divide? We can see is there are different phase of the cell cycle. This is a cell. This diagram shows the cell cycle. That means cell proliferation stage in start with the G1. So in G1 phase, what happened that basic necessary thing for the synthesis like protein, like RNA are synthesized in G1 phase. Here in S phase, the DNA synthesis occur. In G2 phase, and there we can see the duplication of chromosome occur, and in the M phase, mitosis occur. From one parent cell to form 2 daughter cell is same in chromosome number. Here we can see in this diagram also is Z0 is a resting phase, so no any multiplication, no any function here, and it goes into the G1 phase and S phase, G2 phase, and M phase. And later we can see the from 1 to get 2 daughter cell. Is a genetic disease, cancer or genetic disease? How the genetic disease that occur in the cancer, From the left side, we can see the normal cell at a resting position. Here we can see this is the receptor, it's an inactive growth factor receptor, and there is a number of inactive intracellular signaling protein, and inside the nucleus there is an inactive gene regulatory protein. So it plays an important role for the transcription. If this cell get the growth factors and is activated, and here we can see the series of transduction occur, activated the intracellular signaling protein, and here consequently it's activate the gene regulatory proteins that helps to transcription in the nucleus, and in this way the normal proliferation occur. Here in the right side we can see the cancerous cell. Though there is no any growth factors at this position in the receptor, here is a like abnormally active intracellular signaling, and there is a transduction occur, so this signal transduction like relay that transfer into the nucleus and active the gene regulatory protein, and transcription occur. Consequently, the cell proliferation happens despite the absence of the stimuli. So this is the stimuli. Despite the absence of this, stimuli, they proliferate uncontrollably. This is the function of the cancer, means how the cancer cell proliferate. Now you can see in this slide, here is the mutation, how the mutation occur. It might be the X-ray, gamma rays that affect the sequence of DNA and is a permanent alteration in DNA RNA sequence, and it will change the genetic message, means transfer from parents to offspring, or its signaling is obstructed. So the basic function of the normal cell is affected by the mutation. Here we can see the how the genetic regulation disturbed in the cancer. One is the production of the oncogenes. So if there is a increase of production of oncogenes means means the cancerous genes. We know proto-oncogenes are commonly that is present in our body. If there is mutation, if there is any sequence disturbed in the DNA sequence, then it's converted into oncogenes. That oncogene is considered as the cancerous gene. So further, the in this diagram we can see the normal cell it own is follow the own signaling pathway, and it's proliferate and regulate the cell growth. Here in case of cancer cell, what happened, there is a mutation damage and form the oncogenes, and the oncogenes that accelerate the growth and cell divisions, and its rapidly proliferation occurs and increase the mass of the cell. And another thing is like is genetic regulation that disturbed in the cancer cell by reduction of tumor suppression. One is production of oncogene, and second is reduction of the tumor suppressor gene. These are the two ways that genetic regulation is disturbed in the cancer cell. So if there is a reduction in the tumor suppressor gene, what happens here, you can see it act like a brake pedal. If the tumor suppressor gene like your protein inhibit these proteins, if this tumor suppressor gene is reduced, that means this signaling transduction is affected. As a result, the transcriptions of like multiplication and cell proliferation is increased. So division is very rapid. Now moving to the cancer pathogenesis, how the cancer occur. The mutation in gene of the cancer by either acquired environmental factors like chemical, radiation, or viruses. Another inherited mutation is genetic factors that might be I told you, like a BRCA, PSA, and other genetic CAA. These are the other genetic factors that lead to cause the mutation in the genome of the cell. Then after that, what happened after the mutation? Then there is a mutation activation of growth promoting oncogenes, and another is alteration of gene that regulate the apoptosis. Apoptosis means we know this cell death process, but it is necessary for the for the normal cell, for the repairing the new cell and repairing the new cells. It is necessary, but in case of mutation, whatever there is alteration that regulate the apoptosis is not follow the proper signaling. Another is the inactivation of the cancer suppressor gene. After that, what happened, there is a expression, alter the expression of the gene product, and the loss of regulatory gene proteins. That means like regular functioning of that gene is altered, and finally lead to the malignant neoplasm. These are the basic pathogenesis for causing the cancer by the mutation in the gene. Now, what is the benign neoplasm and malignant neoplasm? Is commonly used this terminology in case of while talking about the cancer. So benign means like non-cancerous, is not so dangerous type of is a harmless. Benign is a harmless cancer, and malignant is a harmful cancer. So it's benign neoplasm, it grows slowly. In case of malignant, it grows rapidly. And in case of benign neoplasm, we saw its morphology is specific. And in case of malignant, what happened? The morphology is anaplastic. Anaplastic means that is completely different from the parent cell. And in case of benign, the nucleus is smaller, like is almost like a regular type of cell. But in case of malignant, the nuclei is larger than the normal cell. In case of benign, the cell is differentiated, means like it's not completely different from the normal cell, is can differentiate it. Whereas in case of malignant neoplasm, what happens is like cell cannot be differentiated. So its function is like different from the original. In case of benign, what happens that tissue adhere each other tightly, whereas in case of malignant, that tissue that cells are not attached with each other, means loosely attached. Yeah, that's why it's maximum chance of causing the metastasis because of loosely adhered to the surface. And another is grow in benign, is grow in orderly manner, whereas in case of malignant, it's grow invasive, means it's invade the other organ. Benign case is localized, and in case of neoplasm, it can be metastasized. These are the two difference between the harmless cancer and a harmful cancer, means benign and neoplasm. There is difference. Uh, Talking about some basic terminology of the cancer, we know cancer, we say, is a disease. It's not a disease, is a group of disease. Now, what is hyperplasia? We commonly use this term is hyperplasia is in case of BPS news, benign prostatic hyperplasia. That means hyperplasia means that cells that increase in number of cells, but it is not different from the normal cells. It is this morphology is similar like the normal cells, though its number is increased. It is well differentiated. Whereas in case of is dysplasia, dysplasia means abnormal shape and size. Its shape is completely different from the origin, and anaplastic means lack of differentiation. It's difficult to differentiate it from one cell to another. So these are the basic terminology that you use in case of studying about the cancer. Now, what is metastasis? No, we frequently heard about this like metastasis. What is metastasis? The metastasis here we can see the primary cancer. If some patient got cancer, that is primary cancer, and if we have this sometime it we got cancer at another time like lungs cancer. So this is the primary cancer. It is spread via the circulatory system, like either blood or lymphatic systems. It spread to the other organs. That is known as the metastasis. That condition is known as metastasis. So this is the primary cancer, and liver metastasis and lung metastasis, this is a secondary cancer. So so this is about the metastasis. Then spreading to the other part of body is the metastasis. Now the tumor angiogenesis. What is tumor angiogenesis? The blood vessels grow on the cancer cells is considered as the angiogenesis. if we see the tumor secrete the vascular endothelial growth factors, this is the growth factors that release from the tumor to the blood vessels, and the blood vessel attracted to form the blood vessels into the cancer cells. Let's increase the blood vessels expression and movement toward the cancer. And thirdly, what happens that increase the that formation of blood vessels into the cancer, and form the is easy to form the increase the size of the tumor by increasing the vascular system into the cancer. Now, talking about what they are called means on the basis of tissue origins, what we called in case of benign, in case of malignant. So, if the origin is epithelium, like from the surface epithelium, in case of benign, what we call is as a papilloma, and in case of malignant, what we call is a carcinoma, is a squamous or epidermoid. So, in case of glandular, what we call is a adenoma or adenocarcinoma in case of malignant. If the tissue origin from connective tissue, that is fibrous tissue, in case of benign, what we call is a fibroma, and in case of malignant is fibrosarcoma. So is a suffix. You can see is oma is attached with the tissue origins, that is a benign. So bone is osteoma. In case of malignant is sarcomas. So smooth muscles origins then is called as leiomyoma. In case of malignant, what we call is a leiomyosarcoma. So it's if origin is from fat, that is lipoma, and in case of malignant, what we call is a liposarcoma. So lymphoid tissue and hematopoietic cell. So if origin from this cell, and in case of bone marrow element, what we call is malignant case is a leukemia. If a lymphoid tissue involved, then is called lymphomas, is Hodgkin's lymphomas and non-Hodgkin's lymphoma. And if plasma cell is involved, that is a multiple myeloma. So in this case is only malignant. If the tissue origin from the neural tissue, then is ganglial tissue. Its origin from the ganglial tissue. That in case of benign, what we call is a gangliomas. Is in case of the tumor origin from nerve sheath is a neurofibroma. And in case of a melanocyte, what is called is a mole. We can see is a mole, that is a benign type of. And in case of malignant, what we call if origin from the ganglial tissue is glioblastoma multiforme. And in case of nerve sheath, there is the astrocytoma and melanocytoma. Origin from melanocytos, what is called is neurofibrosarcoma, and is malignant melanoma. If its origin from gonadal tissue, then what is called is a teratoma, and it's in case of malignant, what is called is a teratocarcinoma. So these are the basic terminology we need to understand while studying about the benign and malignant cancer. Now moving into the cancer diagnosis, how the cancer is diagnosed. Cancer can be ruled out by observing signs and symptoms like hemorrhage, if there is a lump present in our body, if any pain in our body, abnormal skin, ulcer, obstruction, weight loss, anorexia, fatigue, neuropathy. These are the some signs and symptoms that helps to rule out the cancer, but this is not a like exact sign and symptom for the cancers, so it might be vary, so it helps to rule out the cancer. Now talking about the diagnosis, and another way how the cancer diagnosis is routine cancer screening, like breast cancer examination, pap test, and mammography, pelvic examination, and testis self-examination, and blood test for the like prostate. These are the some regular cancer screening helps to diagnose the cancer. and biopsy is for the histopathologic examination by observing in microscope, observing the different type of tissue. So these are the some tools that help to diagnose the cancer: hematology, tumor marker, and medical examination like the CT, MRI. These are the tools that helps to rule out the cancer. Here we can see the different shape and size of normal and the cancer cell. Here we can see in the pink color, that is the cell is normal cell, like normal proliferations. Here we can see in cancer what happened: the large number of irregularly shaped dividing cell. And in case of normal it is so regular shape, but in case of cancer what happened, there is a large variably shaped nuclei, and you can see the cytoplasm also less compared to the normal cell. Has small cytoplasmic volume relative to the nuclei, and each cell is different in size, shape and size. You can see in normal size, so every cell is same in shape and size, but we can see in cancer the cell size is, some is round, some is star shape, some is like shrinking like this. And another is loss of normal specialized cell features, like if new nerve cell has like this, and in case of cancer what happened, the nuclei is large and it's not the same like the normal cell, so its normal specialized cell feature is lost. And what happened in case of like disorganized arrangement of the cell, so arrangement of the cell is also disorganized. And another is a poorly differentiated boundary, means like uh, it is in well mannered in normal cell, what is it is arranged in well mannered way, but in case it is not managed in well mannered, is poorly defined, and boundary is like unlimited, so it can spread to the another place. Now moving to the staging of cancer, how the staging help to uh, uh, recognize the different type of cancer and treatment of those cancer. Basically, there are four stages of the cancer. Stage first, the extent of disease is only localized, and treatment modalities would be the surgery and the radiation. And the stage second and third, the disease extent is local and the regional spread. So in that case, the treatment modalities would be surgery, radiation, or chemotherapy. So in stage 4, what happened? The extent of disease is distant metastasis. Is metastasis is already spread to the another organ. So the treatment option is only chemotherapy. We cannot perform the surgery or radiation in that case. Now, according to the American Joint Committee on Cancer, 8th edition, so on the basis of TMN, is T stand for the tumor size, and stand for degree of nodal involvement, M stand for presence or absence of distant metastasis. And here is some example that how it denotes. Like TX means that tumor cannot be differentiated, diagnosed, and tumor size. T naught means no any tumor size is observed, like this. Here further talking about this staging, we can see the stage second A, how we considered as the stage second A. If the A, we can see the T1 is a primary tumor. In Bayesian, if the tumor size is less than or equal to the 20 mm and is about the breast cancer, and this is the T1, means only one mass or only one tumor size is we see. And here we can see the N1, that is the lymph node involvement, that is 1 to 3 axillary lymph node is involved, that is considered, is denoted as a N1. For the breast cancer, the size and the number of node combine to determine the stage. So in this way, the staging is performed in case of breast cancer. Similarly, the another example for the breast cancer staging, like tumor size. If tumor if indicated as T1 and its tumor size would be 0 to 2 centimeter. If denoted as T2, then tumor size would be 2 to 5 centimeter. If denoted as a T3, then its size is greater than the 5 centimeters. Similarly, like if T4, its size is more bigger and is already attached to the wall of the chest. And N stand for the lymph node, means status of the lymph node. N node is the surgeon that cannot feel the lymph node, and in case of N1 indicate that the surgeon can feel the solo node, means N1 node is feel by the 1 to 3 node is present uh, by the surgeons is considered denoted as a T1. Similarly, the M is stand for metastasis. If M not denote denote for the tested node are cancer free, means there is no metastasis. So it can be the cancer free by treating the different type of different treatment modalities. And M1 means that is already metastasis is present, like micrometastasis occur. Now, after that, how we can measure the survival by the staging, means survival by staging of breast cancer. We can see this different colored line. Here we can see the stage first breast cancer. In this, the 5-year survival rate is more than 90% if we diagnose in stage first. If the diagnosis and the breast cancer is at stage 3, then the survival rate for the 5-year is supposed to around 70%. And in case of the fourth the stage breast cancer, we can see the survival rate is less compared to the first, second, and the third. It's between the 20 to 30% of 50% survival. So it is difficult to survive if we uh, observe or diagnosis at the stage 4 of breast cancer. So in this way, we can say the 5-year survival by the staging. Now, how does staging work? Means how the staging we do means by the X-ray, CT scan, MRI, ultrasonograph, bone marrow biopsies, bone scan, lumbar puncture, and lab tests. These are the some tools that parameters have to staging the different cancers. So, what is the importance of staging? To determine the size of tumor or TMN staging, and different type of treatment modalities means either chemotherapy, surgery, or hormonal therapy, and goal for the treatment is for the cure versus the palliation. So these are the three main objective for staging. Now moving to the cancer treatment modalities. Basically, there are two treatment modalities, surgical and non-surgical. But we can see in non-surgical there is a list of therapy in under the non-surgical therapy. We can see chemotherapy, radiation therapy, hormonal therapy, immunological therapy, biological, and supportive therapy. These are the some non-surgical therapy for the treatment of cancer. You know, the chemotherapy this commonly used commonly used while treating the cancer patient. This term coined by the Paul and Reich during the identification of a agent that inhibit the bacterial cell growth. The term now applied to use the cytotoxic drug used to treat the cancer. Now previously it used for the bacterial cells. Nowadays it used in the case of cytotoxic drug, that is a chemotherapeutic drug, that is a cancer drug. Now chemotherapy, this chemotherapy basically used to prevent the cancer cell from proliferating, that is invading and metastasizing, and chemotherapy drug affect the multiplying cell, means rapidly multiplying cell, and it affect those cells that is rapidly multiply. What is the goal of this chemotherapy? The goal of this chemotherapy is to shrink the tumor before surgery or radiation therapy, destroy the microscopic cancer cell that may remain after the surgery or radiation, destroy the cancer cell that come back or spread to the other part of the body, means it has to prevent the spread of other organ, and control the tumor growth when a cure is not possible. So in this way also you can use the chemotherapy. These are the some goals that to achieve this goal that oncologists use chemotherapy. And now about talking about the surgery in cases. So for different purposes, the surgery is used in cancer for diagnosis purpose and for the cure, control and palliation and reconstruction. Diagnosis for in case of like some masses in our body, so operate that part and send the mass to the laboratory for the further diagnosis. So these are the some purposes use some surgery purposes for purposes use in case of surgery. And radiation therapy, you know, the treatment of drug by the ionization radiations, it damages the DNA, lead to the cell death. So radiation basically used for killing those cells by damaging the DNA of that cancerous cells. What is the principle? The principle of this radiation therapy is fractionating to prevent bystander injury to surrounding the normal cell. Means it's there are different types of radiations, so its main focus is to focus on the cancerous cells. What is the goal of the radiation therapy? To cure, control, and the palliation. To cure or shrink the early stage cancer, we performed the radiation therapy and stop cancer for recurring. Like is to prevent the comeback of that cancerous cells in another area, we use radiation therapy. Or palliations, to treat the symptoms for advanced type of cancer, we use the radiation therapy. Now we can see here is the figures. We can see that the patients lie down, and that is a huge machine that focus on that the cancer area and give the radiations a different gray like is used as per the requirement. Here we can see the X-ray that the imaging observed in that the film. So this is another example of how the radiation therapy done in the laboratory in hospital. Now talking about the hormonal therapy. So basically this drug is used to alter the effect of the hormone. It's used for the cancers that are hormone sensitive. This hormone therapy is used in those type of cancer that are sensitive to that hormones, like uterus, prostate, and breast cancers. In this type of cancer, the hormone therapy is preferred. Example like anti-androgen for the prostate cancer and anti-estrogen for the breast cancer. Now talking about the immunomodulating therapy, that is, and modulate the immune system by applying the biologic agent. So using the biologic active agents to activate the immune system to fight against the cancer. For example, interleukin-2 or granulocyte colony granulocyte colony stimulating factors. And another is monoclonal antibodies, for example, rituximab, trastuzumab, nimotuzumab, and other cetuximab. These are the some maps are monoclonal antibodies that also used to modulate the immune system to kill the cancer cell. Now, after treatment, we need to check the response, tumor response. How can we check the tumor response? By reduce in the tumor size, by the palpitation, radiological measurement, radioisotope scan, and another is by this way we can find out the tumor size, if they are shrinkage or not. And another is reduction in tumor cell count in case of leukemia. So increase the WBC count. In reduction in tumor cell marker like immunoglobulin in myeloma, and CEA in colon cancer, PSA in prostate cancer. These are some marker used as the reduction, used as the precursor for is there any changes in the tumor marker or not, and in this way the tumor response or not we can rule out, we can determine. And another is reduce the size or different effusions. So in case of ovarian cancer, for example, reduce the size or effusion is one marker, one precursor to see if there improvement or not, and improvement in the organ functions. These are the some things that we need to check to check the tumor response, that the giving the therapy is okay or not. Now talking about the different response, we know we commonly use this term in the like we see in the different articles like complete response. Then what is complete response? It is a complete elimination of all evidence of disease for at least 1 month. Means a complete emission of all evidence like disease for at least 1 month. It's similar to the complete remission. It's required for the cure, although it's not same like the cure, but it's similar to the complete remission. In that time, the patient are free from the disease. That is called as the complete response. Means like it's completely respond to the cancer. Another is a partial response. That means if the tumor burden is greater or equal to 30% reduction, and generally at least generally that lasting for 1 month, or no lesion is formed during that period, that that term is considered as a partial response. Measurable response or minor response. If the tumor burden is less than 30% reduction, that is considered a minor response. Now, what is considered as the stable disease? If there is no changes in tumor size, that means is a stable disease. Now, progressive disease, that is PD. If the tumor burden is increased up to 20% or new lesion is appeared during the therapy, then it considered as a progressive disease. Means disease is progression. And now after that, the response, we need to evaluate the survival response. How we can evaluate the survival? So by determining the survival, like different types of survival we can see, like disease-free survival, that progression-free survival, and overall survival. And we know what is the disease-free, like completely free from the disease, and progression-free survival means PFS, is short form is PFS. What is progression-free survival? That means the length of the time during and after the time Professor, of the disease, that is cancer, respected Professor, and the patients live with the disease. We know what is the disease, but like it's completely free from the disease and worsen during the duration. Survival, that is considered as the progression-free short form is PFS. Survival. What is and overall survival means as a whole it's all like completely cure of the disease. And now talking about the duration of response or time to progression, TTP. What is the TTP? It is considered as the length of time of the date of diagnosis or treatment start to the disease progress, like progression duration. So starting point of diagnosis or treatment start to the disease progression duration of time is known as DTP, time to progression, and we can evaluate by toxicities by observing the toxicities and quality of life. By quality of life can be analyzed by cardioscopy parameters. So effect of life and the family, we can analyze the response. Normally, in cancer therapy, combination therapy is more commonly used. Why the commonly used means like a combination therapy with surgery, radiation, and other treatment modalities is used. In order to achieve the best response, we use combined modalities. So example, the mastectomy followed by radiation and adjuvant chemotherapy to prevent the systemic metastasis. Mastectomy means that removal of breast is the mastectomy. So after removal, after doing surgery, then radiation is given, and as well as the adjuvant chemotherapy. That means after main therapy, the adjuvant therapy is given. Adjuvant chemotherapy means those therapy that given after the main chemotherapy, main therapy, that is adjuvant therapy, to prevent the systemic metastasis. So to prevent this complex that metastasis, we use the different treatment modalities at once. Now, what are the rationale of the combination therapy? That I already told you, in cancer cell, for the treatment of the cancer, we use many different treatment, different therapy at the same time to decrease the resistance and to remove the or to intolerable in case of chemotherapy, there is an intolerable side effect. To remove the side effect and prevent the resistance to cancer cells, we use in combination therapy and to get the right goal. Now, talking about the different classification of cancers, anti-cancer drug is alkylating agent, antimetabolite, antibiotic, plant alkaloid, hormone therapy, biologics like immunotherapy, and miscellaneous. These are some list of drugs that use to treat the cancer. Here we can see in this table, like in the left side, there is a list of alkylating agents like temozolomide, procarbazine, cisplatin, ifosfamide with mesna, oxaliplatin, carboplatin, mefalpan. Temozolomide is alkylating. It's used in the glioblastoma multiforme. It's GBM. It's used in GBM. It crosses the blood-brain barrier and is considered as a cell non-specific agent. What is mechanism? It's inhibit the synthesis of DNA. It's DNA synthesis inhibition, and it's in this DNA synthesis inhibition occur and cancer cell death occur. Similarly, if we see the cisplatin, this cisplatin is considered as a cheapest type or traditional anti-cancer agent. It also non-specific. Is a platinum analog. Is alkylating agent. It acts on the DNA. It forms the cross link. It's attached with the DNA strand and cross-linking formations, and it disturbs the sequence of DNA and inhibit the cell division, further cell division. Similarly, the oxaliplatin also used in the colorectal cancer. It's alkylating agent is used to inhibit the DNA inhibit the cell division formation by attacking the DNA. Similarly, the antimetabolite agent like methotrexate, cytarabine, mercaptopurine, gemcitabine, pemetrexate, thioguanine, capecitabine, fludarabine phosphate. These are the antimetabolite, and it has its antimetabolite activity in the cancer cell. Like methotrexate is used in many cases, is commonly used in like cancer, like different types of cancer. It's in colon cancer as well as other breast cancer. It is used with a high dose. It is a folic acid inhibitor, and it prevents the DNA synthesis. Like gemcitabine also used in like breast cancer, prostate cancer, and lungs cancer. It also used as a first line, second line use in a different cancer. It is a cytosine analog. It's considered as a pyrimidine analog. It's inhibit the DNA synthesis. It act on the pyrimidine positions and inhibit the DNA synthesis. Pemetrexate is commonly used in non-small cell lung cancer. Is an NSCLC. C is a folic acid analog, is antimetabolite. It inhibit three enzymes, like it's also inhibit folic acid inhibitors, purine, as well as pyrimidine. Three pathway is blocked by this pemetrexate. So this is effective for non-small cell lung cancer. Similarly, capecitabine also used in colon cancer and other cancer is using. It's also cytosine analog, a pyrimidine analog. It's inhibit the DNA synthesis. Now talking about the antibiotic, this is not like a usual antibiotic. It is a cytotoxic antibiotic. You know, it's daunorubicin, epirubicin, doxorubicin, bleomycin. These are some antibiotic used to treat the cancer. It's prevent the replication, the DNA replication. It intercalate the DNA and is break the DNA and prevent the replication. Now talking about the plant or alkaloid or plant derivatives, that are the paclitaxel, docetaxel, and vincristine, irinotecan, ipotecan. These are the plant derivatives. So it act on like paclitaxel, docetaxel, and vincristine act on the mitotic phase. Is cell cycle specific. It act on the mitosis phase. Paclitaxel act on the act while separating the daughter cell, while separating the cell. In that case is used. In vincristine also is used in microtubules, is hinder the formation of microtubules. Here we can see irinotecan. Irinotecan is topoisomerase first inhibitors. Means topoisomerase is necessary for the DNA replication, and here also topoisomerase second also required for the DNA replication, and it's promote the apoptosis, that it's the cell death occur. In this way, these plant derivatives act on the cancer cell. Moving to the hormones, means hormonal therapy, that is tamoxifen, bicalutamide, letrozole, anastrozole, exemestane. These are the some hormonal therapy, hormonal agent. Like tamoxifen is letrozole. They are commonly used in breast cancer. Like is an estrogen antagonist, means is bind to the estrogen and competitively bind to the estrogen receptors, and it's inhibit the proliferation of cancerous cells. Similarly, like this in anastrozole is a non-steroidal aromatase inhibitors, stop the synthesis of estrogen from the androgen. Exemestane is a steroidal aromatase inhibitor, stop the synthesis from the estrogen, stop the estrogen synthesis from the androgen. Now here is some miscellaneous drug. Is L-asparaginase. This is the protein enzyme that is necessary for the conversion of asparagine into aspartic acid and amino acid, asparagine in ammonia. Here, if this enzyme is used, asparagine is in. If the asparagine level is increased, then it's lead to kill the cancerous cell. And here is bortezomib, hydroxyurelase, gefitinib, imatinib, thalidomide, lenalidomide, elatinib. Is gefitinib and elatinib is considered as EGFR inhibitor, is also as a targeted therapy in a lung cancer, non-small cell lung cancer. Is a second generation EGFR inhibitors, is basically act on the epidermal growth factor receptors, and it's inhibit the signal transduction that I already showed in previous slide, and inhibit the proliferation of the cell. Here you can see lenalidomide also inhibit the VEGF, vascular endothelial growth factors, and it prevents the angiogenesis. Now, talking about the supportive therapy, these are some supportive therapy that is required for the cancer patients to live to improve their quality of life, like zoledronic acid. In case of metastasis of bone, then we use zoledronic acid to prevent the bone resorption. It helps to apoptosis of osteoclast, and leucovorin is used as use along with the methotrexate anti-metabolites. Actually, folic acid is necessary for normal cell as well as the cancerous cells. For the normal cell, it's is necessary. So we use to rejuvenate the normal cell. And filgrastim, we know, is a granulocyte colony stimulating factors. We know in the cancer chemotherapy, it's more common type of adverse effect we see in the patient is neutrophil count, and so patients are not able to fight against the simple disease like common flu. So that immune system is drastically reduced. So to increase the neutrophil count, we use the neutrophil, we inject the neutrophil to the patients to promote the neutrophil count. Here, another anti-vomiting agent is palanosatron, ondansetron, granisetron. These are the 5-HT3 receptor antagonists. These are the important for chemotherapy-induced nausea vomiting. This chemotherapy-induced nausea vomiting is not same like other type of vomiting. It is very severe type of vomiting. So it reduces the patient's quality of life drastically, and to improve their quality of life and compliance to the chemotherapy, this supportive therapy is very necessary. Like it prevents the vomiting reflex. With this slide, I would like to end my presentation. I hope this presentation will be helpful to the student over there, and best of luck for the study who are studying despite of these challenges. Thank you. Thank you. Okay. Sorry. Yeah. Yeah. Oh, right. Mhm. Sorry, I couldn't get you. Right. Actually, what happened? Actually, I just want to know the in the clinical. besides the clinical, what actually in the laboratory basis, I never saw like this, like such. It's like finding new thing, and it's always boost me to find new thing and learning new thing. So it's apart from the clinical side, it's like preclinical, we can say. It's interesting to do research. So finding new pathway for the cancer. So now I'm doing finding the pathway. It's like a signaling pathway, it's normally is not commonly studied in our course book. Is different from the course book. We are not focused in that case, but I want to choose this, like how this is in micro, what is it, is a small observation how it's work. So I want to learn that stage. So I choose this research. Oh, actually, this present is though is basic, but every student I think should know the basic first before talking about any big thing. Basic thing is very crucial. So initially when I joined this PhD degree, though I learned some basic thing but not so detailedly. But now I know that basic thing and is minute thing is so important in the research. So never ignore the small thing. If you are not inquisitive about the some small things, that is difficult to achieve the goal, actually. So try to be always curious about new thing. I think if some student want to pursue the further study in the like research, so it's welcome. So you first always put in your mind that basic is must, actually, and the principle of everything is like any tools, any is very important. All right. Oh, actually, in our country, like in previous days, there is no such like particular cancer institute, any hi-fi. Is not particular cancer nowadays. Like doctors and oncologists are also increasing in number than in previous days. I'm also working on that field in 2 years, actually, as a like marketers, educating the all other about the basic things too. And here I saw that though there is a many technology is available, but still they are using the commission like traditional type chemotherapeutic aging to the patient because of their financial status. And so we know it's challenging to treat the cancer. Basically it's very challenging in developed countries as well as, so it's very costly disease, we can say. So it's if we able to get the it's new things in this field is really benefit for the patient. I think in our country is basically is traditional type is used like chemotherapy for the breast cancer. Firstly use like doxorubicin and other anthracycline is used like this. uh, so that's a new recently new cancer therapy, means cancer hospital is like established. like Nepal research cancer is associated with the I think one Indian I think associated with Rajiv Gandhi, something like Rajiv Gandhi hospital, I think. So I'm not sure actually. It's associated with this institute. So nowadays is the doctors are doing quite well. They are using the new drugs like trastuzumab and pneumotuzumab as well as situzumab, also using to the those patients who are really need for that indication. Actually, what happened in our country, what it's normally relationship with I have good relation with the almost all the doctors in our country because I worked a bit long time. It's around 1.5 years with them and communicating and interacting with them about the new things like a new drug, if there is a new drug launch, and we will discuss about in a meeting like this in a seminar. I have attended some several seminar and conferences, and I know the like how they uh, approaches to the patients with the new therapy like this. Yeah, it's a little bit good going nowadays as compared to the previous. Uh, uh, Actually, though, it's a pharmacist is considered as a like in Western countries is a highly paid is comparable with the physician like doctors and other like medical persons, but it's I think it's same like in your country like this like though it's I think it's lack of competency in our students. I think so. To compare with the like doctors, we really need to competence with the doctors because we know pharmacist work is not to only dispensing. It's to explore in many things like in hospital like ADR means pharmacovigilance and clinical pharmacist concept is still lacking in our country. I think it's uh, doctors are also not understanding the basic role in the hospitals means hospital setting, so we really need to uh, make them aware that we are also part of the medical team and can help or can go in multidisciplinary way. So this is the most important thing to make them like understandable to with the doctors. I think that is very important. So I think students, everybody listening, so they must be like competent. Competent is very important. So knowledge is a power, you know. If you don't have knowledge, then nobody count you. So I just want to focus you whatever you read with the what is from your heart and be competent and not to hesitate to ask to anybody any questions and is always learning is learning every day we are learning, so don't stop learning in any field from any ways. So it helps to uplift our pharmacy like profession among the all the medical team, you know that compared to the it's No, I know the doctor's labels is always in like top positions, but it's a little bit difficult to cope with, difficult to work with the medical person like is doctors in the lab that I have also faced in my internship. I feel like I'm also lacking in the competency level. So I have learned from them as well as the other people's other medical. So basic things also matters. Basic things is our backbone. So pharmacy related like pharmacology, our backbone. So we always understand about the mechanism action and other things. Always uh, what it says is keep in mind. It's always updated. It need to be updated by the student. Yeah, uh, okay, okay. Thank you for your invitation. Like, thank you for everything because it's a really pleasure to be a part of this. It's a very like a crucial time. COVID-19 is, is very challenging every sectors, and students are not able to attend their regular class, exams, and other things. So it's a really tough time. Despite of this, so your team able to make a type of webinar to boost your students, and hopefully I also I think I am able to convince them in the basic level about the cancer cell biology and therapeutic approach. I think so. Thank you. They are. Uh, uh, sure. Sure. Thank you so much. And I really appreciate your invitation. Thank you so much. Uh, It's really pleasure to have meeting with you. Okay, thank you, thank you. Okay.
you